The PUD, which is the peptic ulcer disease, is the ulceration, corrosion, or destruction of the gastrointestinal mucosa of a patient's stomach lining or the duodenum. This simply means that there will be sores in the stomach region of the patient or the duodenum, that's the small intestine, and this ulcer is basically classified according to where this particular corrosion is happening. That's the site of corrosion, either in the stomach or in the duodenum. My name is Nurse Sonia, and on this channel, I talk about related information on nursing, medicine, and healthcare. If you're just joining us here for the first time, you are welcome. And if you're a returning subscriber, thank you so much for always watching my video. In today's video, we're talking all about ulcer, the causes of this ulcer, the signs and symptoms of this ulcer, the treatment, and most importantly, how we can prevent this ulcer. We already know what this ulcer is, and the type of ulcer I said is it can either be a duodenal ulcer or a gastric ulcer. The gastric ulcer is the corruption or the sores that occurs in the mucosal lining of the stomach, while the duodenal ulcer is the type of sores that occurs in the small intestine of a patient. Now let's move into the causes of this peptic ulcer. We have numerous causes of this ulcer. The number one on my list is excess acid production. It is true that hydrochloric acid secretion is needed for effective digestion of substances, but when it's produced in excess, it damages the GIT of the stomach, therefore leading to ulcer formation. The number two causes of this ulcer is the presence of Helicobacter pylori. We cannot mention ulcer without calling the H. pylori. This H. pylori is actually an organism that people contact even from childhood through food, water, and close contact with infected individuals. These organisms can secrete enzymes that protect them from the stomach acid, and when this happens, they grow and build a wall, therefore start feeding on the mucosal lining. This thing in turn causes ulcer to the particular host. Number three is poor mucus production. When there is poor production of mucus lining by the stomach, which is supposed to cover and protect the stomach from direct contact with this gastric acid, the lining are hereby tiny and not strong enough to fight and protect the stomach when this acid attacks the wall. Number four on my list is drugs. Some drugs, such as the non-steroidal anti-inflammatory drugs, causes gastric irritation. This happens when these drugs are being used for a long period, especially without food. It makes these ulcers develop without an apology. So if you are going to be taking any non-steroidal anti-inflammatory drugs, please be cautious of it and know when and how to take it. Number five on my list is stress. Yeah, some people do not know that there are ulcers that are stress induced. Ask me how. Studies have shown that all forms of physical and emotional mental stress, such as physical trauma, anxiety, and even anger, can increase the production of gastric ulcer in the stomach. Now, this gastric ulcer worsens the condition of an ulcer patient. Number six on my list is prolonged fasting. It is true that fasting has a lot of physical and spiritual benefits, but it's not advised to keep the stomach empty for a long time, because this can make the gastric acid in your stomach to attack the mucous lining of the stomach, thereby causing ulcer to the patient. So if you are this type of person that keeps a long period without eating, you are only inviting ulcer to yourself. Now let's move into the symptoms of this ulcer. If you're experiencing heartburn, if you're experiencing bloating, like you always feel filled, like your stomach is always tight, constipation. Number three, if you are experiencing abdominal pain or even back pain, back pain radiating through your back, you're experiencing nausea and vomiting, you're always like throwing up, like something wants to go out of your mouth. Hematosis, like you're vomiting blood, you're having weight loss, or there's this bloody and dark pool. Anytime you pull, when you watch a pool, it's always comes in a dark color. Then please go to your nearest hospital, do a test, and find out if there is H. pylori in the specimen that they collected. Let us know in the comment section if you found this information useful. Don't forget to turn on your notification button to be notified when we shall come online again to post the part 2 of this particular topic. In that part 2, we'll be talking about other complications associated with ulcer, the treatment of ulcer, and the prevention, how to prevent this ulcer. And also, don't forget to share this video to people that you think that may need this information.